So what we're doing here is intubating the snake, and we're using actually an IV catheter because their trachea is so small. This snake's trachea is so small, and then we just attach it to a normal ET tube attachment, and then that can be easily attached to the anaesthetic line. Now, snakes' tracheal opening or glottis actually sits really close to the front of the mouth, and so it's pretty easy to tube them and also to retube them if the tube accidentally comes out. But to avoid the tube coming out, we will tape the snake's head down onto a paddle pop stick, and then also tape the tube down to a paddle pop stick, so that if during surgery the snake moves around or the tube moves around, those two parts still stay together. To monitor the anaesthesia, we want to hear the heart rate, and so with reptiles of all species we use a Doppler, and we try and get that to sit over the level of the heart, and in snakes that is about 1/3 down from the tip of the nose of the snake, or caudal from the tip of the nose of the snake, and then tape it to that spot so that it doesn't move around.
Grab the maybe two. Okay, just start there. Yeah. Okay. And then around. Because you might have to do what we do with the birds.
And then we make sure that we can hear it okay.
I think we've got contact. Okay, so we just need to give her a breath.
And then we just check that the ET tube is placed correctly and that we can get good inflation of the lungs just by giving a few breaths. And unfortunately with reptiles under anaesthesia, they do stop breathing. Well, they tend to stop breathing most of the time, and so it's up to the anaesthetist or the veterinary nurse to continue breathing for them. But the good thing is that reptiles don't breathe too many times per minute, and in fact 4 breaths per minute is what we would normally give them while they're under anaesthetic. And then we prepare the surgery site, and in this case we just prepared with sterile saline because there was such an open wound. We didn't want anything to affect the granulation bed that had already formed. We use a plastic drape for all my patients because they're all so small. We need to be able to see them. We need to be able to watch them breathe and make sure that they're still okay. So to start the surgery, we just undermined the edges of the skin so that we could bring the fresh tissue together. We were hoping that the cranial wound on this snake could actually be completely closed, which we ended up achieving, which was great. But as you can see, the undermining the skin edges was quite difficult because the skin was so friable. Now, when bringing together snake skin or any reptile skin, it is important that we use an everting suture pattern so that the skin edges will obviously evert, and we get skin on skin contact rather than scale on scale contact. If we had an inverting suture pattern, we'd end up with a non-healing wound site because the scales can't heal together. This particular snake is healing quite well by second intention over that wound site.
So this up here is going to close, really nicely in the next couple of weeks. It'll heal. And this we're going to probably end up doing we'll probably end up doing another surgery maybe to pull this across. Yeah. But in the meantime we're going to just dress it and allow it to start to heal for itself. So I'll just take one more just for the climb, just from on top. It's an awful lot smaller than it was. Okay, that's great.